Welcome to Understanding EKGs. This is your host, Nurse Choma. Okay, so what is EKG rhythm? What does this mean? And what I'm going to do, I'm going to really break it down for you from the very beginning, the basics, all the way to the advanced level. So if you have no understanding, whether you're an international student or you never learned this before in your nursing program, don't worry. We're going to cover it from the very beginning. And the reason why we need to talk about this is because the exam, it covers this on the exam. And many students have been reporting that they haven't been successful with the exam because they received a lot of EKG rhythm questions. So I'm going to go over it with you right now so that you understand it. So you want to first start off, get a notebook, get a pen, not just like one paper because you're going to take a lot of notes, all right? A lot of notes. So what is the EKG rhythm? So electrocardiography is the process of recording the electrical activity of the heart over a period of time using electrodes placed on the skin. So the purpose of us using the EKG, okay, we're trying to record or see or measure what is happening with the heart as far as on the rhythm. Because what's happened is that there's something called the conduction system of the heart, and it releases pulses, okay? It releases these pulses, and this is the activity that's occurring throughout the heart, so that way you can see a rhythm see the rhythm, and we can know what's going on with the patient. And we determine this by simply putting on electrodes, okay, like lead pads on their skin, and put the electrodes on, and we can literally see what's going on in their heart from different angles. So this is the normal rhythm, okay? At the picture to the left, it gives you an image of a normal rhythm, and it breaks it down for you, okay? It breaks it down for you, the rhythm, or the components of a normal rhythm. So if you look over here, you see something called P, you see something called QRS and T. So let's talk about what that means. So the normal rhythm is made of 4 components, right? 4 components. And the P wave represents the atrial depolarization. Let me talk about what that means. So in the heart, all right, in the heart, you have the top of the heart is something called the atrium. There's 2 of them, a left atrium and a right atrium. Below the bottom of the heart is something called ventricles, and there's a left ventricle and a right ventricle, okay? So now what happens is that at the top of the heart in the atrium, there's something called an SA node, all right? An SA node, a sinoatrial node. And what this SA node does is that it fires. It releases an impulse, and it sends this impulse to the atrium. And now the atrium contract, okay? The atrium contract, and that's why you see the P wave, all right? This P wave right here is a reflection, a representation of the atrium contracting, which is called atrial depolarization, all right? So the normal PR interval, so that is here to here, the normal amount is 0.12 to 0.2. You need to know that number, all right? Have it memorized. You need to know that number, okay? Because the exam will test you on that. PR from P to here is 0.12 to 0.2. Now the QRS complex, this represents ventricular depolarization. So now what happens next? So the atrium member, or the AV node, it sends that impulse, and it causes the atrium to contract, which is the atrial depolarization. Then what will happen after that? It will send that same impulse down to the AV node, okay? The AV node, which is in the ventricles. And now the AV node will cause the ventricles to contract, And now so then that will reflect the QRS complex, all right, which is ventricular depolarization. So the QRS is a reflection of the ventricles contracting, and I'll show you an image. So if you can imagine right now that the AV node send that impulse, it caused the atrium to contract. Then the impulse was sent down to the AV node, and then it sent it down to it caused the atrium to it sent it down to the bundle of His out to the Purkinje fibers, and that caused the ventricles to contract, and that's the QRS complex. All right, and then the normal QRS interval, so the distance between here to here is less than 0.12. Memorize that number, less than 0.12. The T wave, though, represents ventricular repolarization. So now it relaxed, okay? The ventricles are relaxing. So the atrium contracts, right? Sends it down to the AV node, which sends it to the bundle of His, out to the Purkinje fibers, the ventricles contract, and then the ventricles relax, which is the T wave. All right? So that's the conduction system of the heart. I'm going to show you a visual, but that's what that reflects on the rhythm. Okay, so we're going to go over the rhythms, the different ones. There's sinus rhythm, sinus arrhythmia, sinus bradycardia, sinus tachycardia, supraventricular tachycardia, heart blocks, atrial fibrillation, atrial flutter, junctional rhythms, torsades points, and there's actually more that's not even listed on here. So we're going to go over these in this training. So this is the part where you want to begin to think more critically. This is what I mean by thinking more critically. It's asking yourself questions aside from just memorizing the material. Okay? So when you want to think critically, these are the questions you're asking yourself. What are the nursing scenarios that match that rhythm? Right? What are the nursing scenarios that match that rhythm? What are the conditions and diseases that correspond with this rhythm? Okay? So this is what I mean by thinking more critically, looking at the exam, because the exam is trying to see, are you an advocate of your patient? Do you recognize what's going on with them aside from just memorizing the material? What are our appropriate nursing interventions? So what do you do? Right? What's your intervention? How are you going to intervene if this happens? So it's about knowing the rhythm, but then knowing what scenario would look like that rhythm, what disease would go with that rhythm, and then how would you respond? What would you intervene with? So here's an image for you, okay? So that way you can really understand what it looks like. So if you look over here, let's first start over here on the right-hand side. So remember what I mentioned? The SA node right here. Look at that image right there. This is the SA node, which is the sinoatrial node. This is where it starts. This is where the rhythm starts, okay? And then it's going to send it, that pulse, I should say. And so then it's going to send it down right here. It sends the pulse down to the atrium, okay? And then the atrium is going to contract. Right? See, look at this, the right atrium, the left atrium. And then now it sends it down, the impulse down to the AV node, which it sends it down to the bundle of His. And then out, the Purkinje fibers is not shown here, but it's like fibers that would be seen right here, okay? But it sends it down to the bundle of His, and then now the ventricles contract, the right ventricle and the left ventricle, which is the QRS complex. And then after that, it relaxes, which is the T wave, and then it starts all over again, back to the SA node, okay? So that's pretty much the makeup of it when it comes to the rhythm. That's how it works. Now, if you look over here on the left-hand side, these are the coronary arteries of the heart. So this is what we're concerned about when the patient has some type of blockage or when they have a heart attack. Okay? Because if there's a blockage in whatever artery, it affects the muscles of the heart. It means that it's going to affect the blood flow of the heart into the rest of the body. So this is an image to show you the right coronary artery, the left coronary artery, and so forth. the left anterior descending artery, and so forth. So you want to understand this as well, okay? In addition to this, so you look at this over here to help you. You look at this over here to help you as far as understanding the actual rhythm from the P, the QRS, the T wave, as far as electrical activity of the conduction system. And you look at this one to help you with the understanding of the blockage when it comes to heart attacks.